Good afternoon, and thank you for joining our Connie informational webinar today. My name is Todd Stack. I'm the General Manager of the Henry Schein Medical Solutions portfolio, and I will be your host today. A few logistical items before we get started. If you have any questions, please type them into the question box in the bottom right. We'll try to answer as many questions as we can at the end. If we run out of time, we will answer your question via email. This webinar is being recorded, and we'll share the link to the recording and the slides with all attendees in the next couple of days. Henry Schein is delighted that Jenn Searls, the Executive Director of Connie, Connecticut's official health information exchange, has agreed to be our speaker today. Statewide, HIEs have the power to make a significant positive impact on patient care, and Henry Schein wants to ensure that our customers have what they need to connect. At the end of the webinar, we'll talk briefly about a solution we have that can connect your EMR to Connie in a fast and easy way that doesn't involve your EMR vendor. In the meantime, I'd like to tell you a little bit about our speaker. As I mentioned, Jenn is the Executive Director of Connie and has extensive experience working with healthcare technology and information systems. Prior to joining Connie, she was the Chief Operating Officer at Soho Health. There, she led the effort to scale a regionally clinically integrated network for the 1,700 providers and 5 hospitals affiliated with Trinity Health of New England, and built the population health infrastructure that fueled the ability of the organization to engage in value-based contracts with payers. Jenn also served as the Chief Information Officer at Pro Health Physicians and held several positions at Med 3000, a national health management and technology services company that is now part of McKesson. She has a Master's of Health Administration from VCU, and most importantly, she has 6 children. God bless you, Jenn. Jenn, I'd say that your 6 children have prepared you the most for this very important role. So I'll turn it over to you.
Thank you, Todd. And yes, I think the 6 children do definitely help prepare me for this role. If we could go to the next slide. First, before I tell you this story about Brenda and Carol, I want to thank Henry Schein for hosting this webinar for us. I am always eager and anxious to get the word out about Connie because I believe so strongly in the power of secure clinical data exchange for enhancing the health and well-being of the state of Connecticut's residents. And so I always think healthcare technology makes much more sense when you get down to stories, because that's ultimately why I get up every day to do what I do. And this is a true story. These are not the real people in the story. It's a stock photography, but this is a story about Brenda and her mom, Carol. Carol is independent, lives alone, but Brenda is her main support. A few years ago, Carol got sick with what her PCP, the urgent care center, and some other folks had said was pneumonia. So she was instructed to head home. She had a couple of medications to help treat the symptoms, but she was supposed to drink some fluids, get plenty of rest, and take care of herself that way. Brenda came to check on her mom and found that she not only wasn't getting better, she was lying on her couch. She was pretty lethargic, almost unresponsive, and her ankles were fairly swollen. Brenda did what you would do, and she got her mom into the closest emergency room, and the ED staff there did what they do best. What's your mom's medical history? What are any medications she's on? Does she have any allergies? Brenda was sure that the hospital ED staff could get access to her mom's medical records because her mom's PCP was on the same medical campus as the ED. Those of you in healthcare know that that doesn't necessarily mean anything, and there was no way for the hospital ED staff to be able to get into the PCP's medical records to get the information that they needed. Now, this story has a happy ending, which is why I share it. In the end, Carol had an open heart surgery. She's fine and she has recovered. As you might imagine, that story sort of made an impact on Brenda. And Brenda was one of the very first people I met when I started as the executive director of Connie. And that story has really stuck with me, especially now as I'm in that sandwich generation of taking care of parents who are going to need this type of care as well. And so if we could go to the next slide, that's why Connie was put in place. The Connecticut General Assembly in 2017 passed a law that required the development of a health information exchange to serve the state of Connecticut, healthcare providers and physicians and insurance carriers as well as other healthcare stakeholders, and to empower consumers. And so I've put the listing there for the statute for everyone to have accessibility to it. But we were really designed to set up the tools, the technology, the services, the processes that would enable HIPAA-compliant, secure clinical data exchange. And so starting in 2021, that is what we have been doing. If we could go to maybe skip 2 slides ahead, I want to go a little bit into some of Connie's tools that are available for providers. All of this information, you will hear me tell you a few times, please go to our website. All of this information is there and more. But Connie today has a couple of sets of tools that we provide for those provider organizations that have signed up and are connected to Connie. And I divide them into sort of 2 buckets or 2 categories of tools. A point of care tool. So the Connie portal or the In Context app are HIPAA compliant clinical query tools, and they allow providers and their staff to view clinical records for their patients. And that can include prior hospitalizations, encounters, labs, radiology images. It also enables them to see other members of their care team. And we get story after story from clinicians about something as simple as knowing who else my patient is seeing is so valuable to staff as they try to manage and coordinate care. Providers can also access the NARCS report using the Connie portal, and also we've developed a best possible medication history. I'm inordinately proud of the work that we've done there, because what we've done is we've taken millions and millions of continuity of care documents, we've parsed medication data and information, we've standardized it, we've deduplicated it, and we are building comprehensive medication lists that are deduplicated, standardized, and are more efficient for providers as they take care of patients. Additionally, in that point of care tool, we also offer social needs codes so that we can see when patients have had codes put on their record that indicate they have housing insecurity or food instability, for example. And we also offer referral history in there. So you can, a provider can access that data through that Connie portal, which is a secure standalone web portal. Additionally, some systems have the ability to have the In Context app, which enables the view of data within the context of their workflow. A whole second sort of category of work that Connie provides are what I call the care coordination tool set. The chief one among this is the encounter notification services. So these are Connie alerts. And so what this enables is for providers and their staff to get access to real-time work lists of their patients as they are transitioning from one side of care to another. So I often use my favorite practice, East Granby Family Practice. They are a patient-centered medical home, and they have staff whose role it is to follow up with their patients once they've been discharged from hospitals or skilled nursing facilities, to make sure that they understand their discharge instructions, to make sure that they understand their medications and to reconcile those medications, to make sure that they get in to see the doctors at East Granby Family Practice within 7 or 14 days, depending on what their discharge instructions say. So using a Connie alert, that staff can sit down on a Monday morning and just walk through a list of all of their patients that were discharged or admitted to a facility over the weekend and do the next right thing for their patients, ultimately taking better care of their patients and ensuring that patients aren't bouncing back and forth between different sites of care. It's a really powerful tool that we're able to enable for clinicians in the state. And to go along with that, I talked about the care team. We also have a provider directory. This is a searchable directory, and it's in fact now more than just Connecticut providers. But if I am trying to coordinate care for a patient, I now have a directory that enables me to see and get the contact information for that provider. So for example, if Jenn presents at East Granby Family Practice, she was in the hospital over the weekend, and it turns out that Dr. Smith at Prime Healthcare is her urologist, I can now get that information to be able to follow up with Dr. Smith directly to take care of my patients. Next slide, please. So I mentioned the Connecticut statute, and the statute is some of what we want to talk to all of you about. The Office of Health Strategy deemed Connie operational on May 3rd of 2021, and that is an important date. If we can go to the next slide, what that date sets off is within the legislation that created or enabled Connie, there is language in there that says within 1 year of that date, so within 1 year of May 3rd of 2021, all hospitals and clinical labs have to apply to begin the process of connecting to and participating in the HIE. And within 2 years of commencement of operation, so by May 3rd of 2023, any individual corporation, facility, or institution licensed by the state to provide healthcare services shall apply to begin the process of connecting to and participating in the HIE. And that includes sort of the usual suspects, your primary care specialty physician practices, but it also includes pharmacies, behavioral health providers, skilled nursing facilities, even emergency medical services and first responders and dental practices are incorporated in that mandate. So we're really trying to get the word out as much as possible to the healthcare ecosystem in Connecticut that there is a mandate for folks to apply to begin the process of connecting to and participating in the HIE by this May 3rd of 2023 date. Next slide, please. So what the heck does that mean, connecting to and participating in? Through work with the Office of Health Strategy, who is the state agency that has administrative oversight over some of Connie's operations, connecting to really means sharing your patient's demographic and clinical data with Connie. And the data types and timelines for that are going to vary by different provider organizations. It's probably obvious, but it's probably worth sort of stating that the data and information that a hospital would be providing into Connie is different than the data and information that a pharmacy would send, which is different than the data and information that a specialty practice would send into Connie. But ultimately, we are trying to meet the goal that the legislature set out for us, that we would create a complete medical record for Connecticut's residents across all healthcare settings. And so every organization that we go to, we work with them to understand what their requirements are so that we can meet that goal. Participating in means appropriately accessing data on your patients from Connie. And that we talked a little bit about the Connie portal as a way of getting access to data, and also the In Context app. The legislature, when they set this whole thing in motion, really felt strongly that it wasn't enough just for you to be providing data into Connie. You really should be looking at it. And you should be looking at it so that we can meet the goals of reducing duplication of services, enhancing quality of timely care for our patients. And you can't do that unless you are accessing that data and looking at that information within Connie. And your first step in all of this, you will probably hear me say this a couple of times, your first step in all of this is completing and submitting your commitment to Connect form. And I can assure you that doing that first step will put you in compliance with the mandate and well on your way to apply to begin the process of connecting to and participating with Connie. Next slide, please. So we do get sort of a couple of questions from folks. There are clinicians out there, for example, many of our behavioral health providers don't have an EMR. The mandate does require you to get a direct email address. So when we talk to clinicians about whether or not they meet the mandate for connectivity, we typically will start with the first checklist or the first checkpoint of, are you licensed to provide healthcare services, yes or no? And if you are, do you have an EMR capable of connecting? If you don't, the mandate does require you to get a direct email address, which is really nothing more than secure email messaging. And the Connie team can help get you set up for that as well. However, I think there's a lot of value for clinicians, even if you don't have an EMR, to get access to the Connie portal so that you can view appropriate clinical information for your patients. We talked to a lot of behavioral health providers over the past couple of weeks about how often they're not notified when their patients go into the hospital, and so then they can't provide the appropriate follow-up care for their patients. And so we've talked a lot about the ability and the value for them in getting access to this HIPAA compliant web portal. A Connie account manager can help set up both of those. Next slide, please. So on the next slide, we also, another question that we get a lot is whether or not my EMR is compatible. And it's sort of one of the reasons I'm excited to do this conversation with Henry Schein is because some of the technology that Henry Schein has to offer to its customers makes this question almost moot. We can connect to Connie. You can connect to Connie using some of the tools that the team from Henry Schein is going to talk about. Connie's not a one-size-fits-all. We will meet you where your technology capabilities lie to help get you connected to Connie, both so that you can meet the mandate for connectivity, but also so that you can get the value of accessing your patient's health information so that you can do the right care and take care of those patients the way that I know everybody wants to in this state. Next slide, please. So you will see this infographic a couple of times. We use it on the Connie website, and certainly if you've gotten any communications from us, this is sort of our 5-step process for getting connected to Connie. You'll see right there, step number 1, get that commitment to connect form into Connie. You can go to our website. The form is listed there. You can even, if you can't find it, send us an email at info@conniect.org and we'll be able to get you connected to the right person. There are legal agreements that you have to sign, right? That we all have to agree to the right rules of the road and to be good data stewards and to follow the rules and regulations around HIPAA for protecting this patient health information. And then your Connie account manager is going to work with you to help on the technical side, getting your data connected to Connie. And again, Henry Schein, I think, has some great tool for you to be able to do that. And then once you're connected, stay abreast of what's going on with Connie. We add new functionality and services all the time. For example, image share, where you can see your patient's images using diagnostic quality image viewer, the best possible medication history, getting affirmative patient consent in the tool. So we're constantly adding new tools and technology into the system. And so staying in touch to be abreast of that is really helpful. But it all starts with getting that commitment to connect form in. It all starts with heading to the Connie website, info@conniect.org, and we'll get you pointed in the right direction and making sure that you're in compliance with the mandate to connect to Connie. Next slide, please. As we talked about, this is really just a further continuation of that concept of every different type of healthcare provider organization has different requirements for what they have to send. Hospitals, by the very nature of sort of what they do, as you can see, have about 7 different data feeds or data types of information that they're sending to us. And if you're a lab, like a Quest or a LabCorp, you really are only sending lab results, right? So we do try to make it very specific to each type of organization so that we get the right data and information and not extraneous information that isn't necessary. Next slide, please. So you may be wondering, well, like, who's participating with Connie now? And for some of you, though we have tried really hard to get out there and get the word out, some of you, this may be the first time you're hearing about it. If you can go to the next slide, please. I think what you will see, hopefully many of these organizations that you see on the slide, you recognize as leaders in our Connecticut healthcare system. Yale New Haven Health, very early adopter of Connie, very much a champion for Connie and getting data in. Hartford Healthcare too, I have to give them props. Even Bristol Health has been a great supporter of Connie. All of their data now comes into the Connie portal, and providers in the greater Bristol area that rely on Bristol Hospital for their referrals are using the Connie portal to get access to data and information that they previously used to log into Bristol's provider portal to. But you can see some other organizations in there: Pro Health, Sohn Health, Signify Health, even some of the Medicaid ASOs. So really a good depth and breadth of organizations connecting to Connie. If you want up-to-date information, though, on who's connected, if we could go to the next slide, I have just a screenshot of the dashboard on our website. This stays updated, I believe, weekly. As soon as we get someone live on a weekly basis, we refresh this dashboard so that everyone is aware of who in the Connecticut healthcare system is connected to Connie and the data that they're submitting. And you can't see it on this screen, but there's a legend that explains what each of those acronyms are: ADT, CCDs, labs, all the rest of that. So this is where I encourage folks, if you have any questions about who's connecting, is my provider connecting, is my local hospital connected, it's here for you to see. Next slide, please. And this is, I call this my Connie by the numbers, and there's even some data and information that's missing here. So what you can see from this slide is we have about 1,300 organizations in the state of Connecticut who have signed up for Connie. There are, I believe, 3,200 organizations that fall under the mandate to connect. So we are well on our way for getting organizations signed up and connected. We 1,800 patients who've opted out of data sharing with Connie. And that is important to me, that we offer patients an ability to opt out of data sharing. Not everyone is comfortable right from the get-go, but we do offer this ability, and I'll talk about it in the next couple of slides. We have about 700 users who are logged into the Connie portal and securely accessing data and information from Connie so that they can take care of patients every day. 356 data feeds coming in. So those are, every hospital, like I said, has about 6 to 7 data feeds providing data in. Most physician organizations are going to have 1 or 2 data feeds. And when you break that all down, what you end up seeing is that we get, on average, almost 10 million admit, discharge, or transfer messages every day, every month into Connie. So these come mostly from our hospital organizations. 75% or 3/4 of the hospitals in the state of Connecticut are contributing at least 1 data feed. By April, I anticipate we'll be up to 90% of the hospitals will be submitting and sharing data with Connie. So I'm really excited about that milestone. We also get about 1.4 million CCDAs every month into Connie. And a CCDA, you can think of it like a PDF summary of an encounter. So when you go to see your primary care doctor at the end of a visit, your system does produce a CCDA, and it's a summary of what happened in that episode. And we get roughly 1.4 million of those a month, and then almost 4 million labs coming into Connie. And all of this combined to produce data on 4 million unique patients. 90% of them have a Connecticut address. So we're well on our way to making sure that we get to that complete medical record for Connecticut residents. Next slide. And I just want to take maybe a minute to talk a little bit about patient consent. It is super important to us that patients have the ability to opt out of Connie if they want to. So if we could move on to the next slide. Connie, in conjunction with the Office of Health Strategy, spent a lot of time doing listening sessions and public comment periods before coming up with our consent policy. HIPAA privacy rule, as I'm sure most of you are familiar with, does allow sharing patient information without explicit patient consent for treatment, payment, operations, and public health purposes. Those also happen to be in line with the purpose of Connie and some of Connie's goals for being established. So accordingly, Connie has implemented an opt-out consent model. So that means data is shareable for HIPAA compliant purposes unless the patient explicitly opts out. We do have exceptions to that. We follow all 42 CFR Part 2 regulations, which require affirmative consent before data can be shared with Connie, and require further affirmative consent before Connie can even reshare that data. So sensitive health information and SUD Part 2 data do not get shared without affirmative patient consent. We do have, and have even before we got the first piece of data in Connie, we do have the ability for patients to opt out of data sharing in Connie straight on our website. And the reason I like to direct patients there is because you can do it one time and we will maintain that consent for you regardless of where you might have seen a provider. So a patient doesn't have to go to Yale, go to East Granby Family Practice, go to Prime Healthcare and opt out of data sharing, they go to Connie's website, we register that complaint, and patients can call it in, they can fax the form in, they can email it, they can send it via snail mail if they'd like. Either way, once we get the form, we will affirm that and let them know that we've received their decision. If we have any data in Connie, we delete it right then and there, and then we put almost a governor. So what happens is any data that comes in, we will first check our consent registry. If that patient has opted out, we delete that data right away. We don't even ingest it into Connie. A patient can always revoke that consent. So if a patient has a conversation with their provider and says, you know what, I understand, I see the value in sharing data with Connie, we are absolutely happy to revoke that consent and we'll update our consent dictionary. We cannot go in and retrieve any of the data that we had or go into health systems and ask for historical data. But from that point forward, we'll have data for it. Patients. So we feel pretty strongly about making sure that patients have this ability and can register that opt-out decision with Connie. So, and we do maintain and look at that data on a regular basis to make sure that we really are doing what we need to be doing with respect to opt-out. And I think that I am done with my slides, so I am going to turn it back to the Henry Schein team. We will be here for questions. I'm happy to answer questions now or in the future about Connie.
Thank you, Jennifer. This is Todd Stack again. So to Jen's point, obviously Schein has tools to help you connect to Connie in what we think is significantly faster and less expensive. So our partnership with SmartLink allows us to connect to well over 90 EHRs out of the box. It doesn't require you to engage with your current EHR vendor. That doesn't take any effort from your clinic. We just need a one-time connection and consent. It's much more affordable, typically half to 2/3 less than what would happen if you did it via your EHR vendor, and it's much faster. We've done many integrations across the country with SmartLink, and typically they're done in 40 days or less. And then there's ongoing support to ensure connectivity. So if something changes with your EHR, SmartLink ensures that that connectivity remains intact regardless of the changes on your system. So specific to the opportunity with Connie, we typically charge $5,300 one time to connect to SmartLink, and that can be paid in monthly payments. We're offering an early bird discount up to $5,000 if you sign up before the end of this month. And then there's an annual maintenance fee that can be paid monthly. Again, that annual maintenance ensures on a go-forward basis that connectivity remains intact regardless of any of the changes with the EHR that may happen on the other side of the equation. So we look forward to having conversations with you and engagement to talk about what SmartLink can do. As Jen mentioned, obviously the first step is to understand what Connie is, sign the commitment, and then engage with folks from the Henry Schein team, which I'll talk about in a moment. Go to the next slide, Jess. So again, Jen provided really insightful information. If you have any questions, please type them into the question box on the right of your screen. We may have some questions in the queue, so I'll hand it back over to Justin.
That was great. Thank you, Jen. Thank you, Todd. Very concise and insightful. We do have a handful of questions. So I'll start from the top and then let Todd and Jen step in to answer these. So we have the first question. What are the penalties, if any, for not connecting with Connie by the deadline?
I should put that in my presentation because it's usually a first or second question we get. Currently, there are no penalties for not connecting by the deadline. We work pretty closely with the Office of Health Strategy around this, and their guidance has been that they are not interested at the moment in levying penalties or sort of punishing folks for not getting connected by the deadline of May 3rd. They reserve sort of the ability to do that later, but right now what they have been focusing on are the value proposition and why folks would want to get connected. And I want to be sort of super clear here that getting connected or meeting that first part of the mandate is that commitment to connect form that puts you well in compliance with the mandate. It gets you in the queue to get connected to Connie, and then you don't have to worry about the penalties that there might be. And also getting connected could give you access to clinical information that would be really valuable to you as you take care of patients. So there are none now. There may be later.
Perfect. Our dental office is mandated to begin application processing by the mandate date.
They are.
Okay. I work with teenagers providing mental health services. Will they have an opportunity to consent or opt out, or will this be left, to the guardian? Looking for information on how to navigate those questions, as I'm sure they will pop up with my clients and their families.
So I guess a couple of things. We'd probably have to turn to attorneys on sort of what rights teenagers have with respect to consent or not as it stands to specifically behavioral health. I know with certain reproductive health issues, teenagers have the right to consent to procedures and the like without their parents' knowledge and consent. I am not as clear on behavioral health. I can certainly take that as a follow-up. The Office of Health Strategy is having a number of listening sessions and information sessions specifically with behavioral health providers. So let me get back to the team on that, Justin. Perhaps I can get information and I can send it to you for follow-up with the folks that are on the call.
Absolutely, we'll be happy to relay that over to the to the inquiry. Another similar piggyback off of that is mental health data offered a layer of protection. So we'll follow up with more information. Okay, when you say you will meet us to connect our EHR, how does it work when our EHR is charging thousands of dollars a year to create an interface?
Well, so I think that's one of the places where the solution that Henry Schein is proposing, SmartLink, is a viable option. And we've heard this from folks. Unfortunately, there are costs that some of the EMR vendors do charge for connectivity, and that's why we're excited to partner with Henry Schein and SmartLink to be able to offer what we think is a more affordable option for provider organizations. Todd, I don't know if you want to add on to that.
Yeah, I would just add and reiterate what Jen just said. And as I mentioned before, typically, integrations direct with the EHR vendor are, upwards of $15,000 to $20,000 and take 90+ days to get initiated and require a whole bunch of teams to review data. We've done hundreds of SmartLink integrations, typically in 40 days or less. It's cloud-based. It's a very simple process. It connects to over 98 EHRs out of the box. And as I mentioned before, for a $5,000 one-time fee and then maintenance to ensure the connectivity is there, we think that's a significant benefit in being able to deploy and participate in Connie and meet the mandate at a much lower cost.
Great. And this is a two-part question. What data do I need to share, and how does Connie manage that sensitive data?
So the first part of the question, it all depends on what kind of organization you are, what kind of provider organization. So why don't I take sort of a standard primary care office, because that's probably the easiest. Typically what that means is sharing some sort of patient roster, either through a scheduling interface that would tell us what patients are coming in, or through a CSV or sort of an Excel spreadsheet file, and then a CCD feed. So this, if you have a meaningful use compliant system, your system should be able to produce a CCD feed. Again, the folks at SmartLink can absolutely help get that feed set up and established for you to be able to send. It's a fairly standard certified EHR technology feed, so most should have them, and SmartLink is well versed for those EMRs that don't have that capability out of the box. For sensitive data, the responsibility for making sure that does not come to Connie falls on the provider organization. So whether you mark that with a flag or otherwise maintain it out of your feed, we ask that you not send it to us unless you do have the patient consent to send that information to Connie.
Great. I believe that those were all the questions submitted. So we thank everyone for their time. We hope you found this valuable, and there will be follow-up. So we'll share this deck and more information. We'll follow up with a specific question regarding mental health, and we'll also share this webinar on demand for those of you who might know people or other folks in your practice who would want to view this.
And Justin, I would just add, as part of the deck, you see Sean Morelli is the Henry Schein Solutions Specialist in the Northeast, in Connecticut particularly. So anyone has questions on the Schein side or SmartLink, feel free to reach out to either Sean or myself, and we'll be happy to respond as quickly as possible.
Great, thank you both.
Thanks, everyone. I appreciate your time. You'll get a recording in a couple of days, and we appreciate everyone's time and effort today. Thanks again. Enjoy the rest of the day.